So continuing on to look at historical descriptions of technical methods, and then demonstrating those for the purpose of discussion and demonstration, as well as to map on concepts that I use to describe treatment or treatment applications within osteopathy. We look at a description from Elmer Barber. Now there should be two cuts up there, or two slides. One of them includes a traction, and one of them doesn't necessarily include that traction. So essentially the method that Barber describes, he doesn't necessarily say that the practitioner should be seated or standing. So the assumption would be that the practitioner is standing. He's talking about grabbing the base of the skull and underneath the chin, so just make sure you're not biting your tongue. So you have to make sure that your patient's not biting your tongue if you're ever going to hold under the chin. I would generally suggest against this because it's quite uncomfortable when you bring any great pressure to bear, as you're pushing the teeth together. So it can be quite uncomfortable. However, he talks about one hand under the skull, one hand under the chin, creating some traction and rotation, right? Now the challenge with this is because your hand goes under the chin, you're biased to one side. So although not described, if you were for some reason to choose to do this method, I would say do both sides or flip your grip, right? So he talks about here, creating some turn, traction, ideally nice straight arms, because if you're bending your arms, you're reefing on the patient quite a bit. It's somewhat uncomfortable. It's also, the practitioner is quite bent. So depending on the height of the table, the height of the practitioner, this becomes fairly difficult. You could also just do this sitting down, or you can use a completely different method. But to stay true to what Barber is suggesting, this is what we do. Now the next thing in one of the cuts, he talks about having your hand under the patient's chin and one under the head. And then what you're going to do is you're going to create traction until the patient's body moves. Now, what I will say here is you want to probably come quite tight to the patient, very, very tight, and then just lean, okay? So you don't really want to use a lot of arm power here. You connect to the patient, so you set your hold, keep everything the same with relation to the patient, and then you just lean your whole body back. Now, based on the size of this particular patient and the fact that his heels are hanging off the end of the table, I'm not going to get much drag here, but it's quite powerful traction, right? So you got to be careful with that. I wouldn't suggest that in many situations, but for some reason, should your diagnostic procedure suggest that you need quite a bit of traction, that is a way to do it. I would generally suggest against it. Final thing that he talks about is basically with your fingers, work on the muscles on either side. He doesn't tell you where to stand in relation to the patient. He doesn't tell you which parts of your fingers. So you could think that he's just talking about moving the muscles in relation to the relatively still neck. And then also when working on soft tissues, generally speaking, you're working perpendicular to soft tissue direction, or perpendicular to fiber direction rather. So it could look something like this. You could flip, so it could just look like this, holding everything on the other side. It could look something like this, moving the muscles there. It's not extremely clear. So this is one of the challenges that you run into when looking at historical methods, that the descriptions that you run into require a lot of words to be very accurate. And if those words are missing, then you're not as clear, right? So a good description of a method in words has a lot of words.